Hi there, I'm Dr. Patricia Martin. I'm a family physician at Unity Healthcare, and I want to welcome you to this video counseling experience for expecting mothers with gestational diabetes. Congratulations on your pregnancy, and thank you for taking the time to learn how you can make some important lifestyle changes to have the healthiest pregnancy possible. I'm joined today by two of my OBGYN colleagues at Unity Healthcare, Dr. Brandy Jones and Dr. Jocelyn Wirtz, as well as nutritionist and new mom, Ms. Robin Rockwell. We encourage you to meet with a nutritionist for one-on-one counseling as soon as possible. We appreciate, though, that you probably have a ton of questions right now about your new diagnosis of gestational diabetes. We hope that this video counseling experience lays the foundation for you to achieve good control for your gestational diabetes. And without further ado, I'd like to start by asking, how about you, Dr. Jones, what is gestational diabetes?
Well, gestational diabetes is a type of diabetes that you can develop simply because you're pregnant. In order to understand diabetes, you have to understand insulin. Insulin's a hormone that we all make. Insulin helps our organs to absorb sugar from our bloodstream to use it as energy. So if we're insulin resistant, that means that our organs aren't able to pull the sugar out of our bloodstream very well, and so we end up having higher levels of sugar circulating in the blood.
How do we even know that we have gestational diabetes during our pregnancy?
Well, we recommend screening all pregnant women for diabetes. We typically screen between 24 and 28 weeks of pregnancy, and we do that by giving you what's called a 1-hour glucose tolerance test. We give you a drink that has a high load of sugar, we have you drink it, and then we wait 1 hour. At that 1 hour mark, we draw your blood and we measure how much sugar remains in your blood.
Is there just a one-time screening for gestational diabetes, or do some people get screened earlier?
That's a great question. Women who enter the pregnancy with risk factors for gestational diabetes, such as obesity, a history of gestational diabetes, a family history of type 2 diabetes, these are women that we screen as early as possible in the pregnancy. If we diagnose an abnormal 1-hour glucose tolerance test earlier in the pregnancy, we follow it up with a 3-hour glucose tolerance test, which is similar, but as the name implies, it takes 3 full hours.
So Dr. Wirtz, are there medications for gestational diabetes, and is it safe for women to take diabetes medicines while they're pregnant?
The short answer is yes and yes. Not all women with gestational diabetes will require medications. Some women, through dietary changes and modest exercise, will be able to control their gestational diabetes without any medication at all. Other women will need to start medication, and the preferred medicine during pregnancy is, in fact, insulin, which, as Dr. Jones mentioned, is a hormone that your body already produces, so it is quite safe to use during pregnancy.
Great. I know we'll have a chance to talk with nutritionist Ms. Robin Rockwell in just a moment about how to manage gestational diabetes with diet, but I wanted to follow up with you, Dr. Jones. Once you're diagnosed with gestational diabetes, how do you know if you're controlled or not controlled?
So the only way to know that your diabetes is controlled on a day-to-day basis is to check your blood sugars.
Sure.
Your doctor or nurse midwife will provide you diabetes supplies to test your blood sugar. That's going to include a glucose meter like this one. Lancets, they come in many different forms, but this allows you to prick your finger to draw the blood, and then test strips. Test strips allow you to put the drop of blood on the strip, and then you insert the strip in the meter in order to get a reading. So you'll be asked to check your blood sugars 4 times a day. Fasting, first thing in the morning before you eat or drink anything, then 2 hours after breakfast, 2 hours after lunch, and 2 hours after dinner. The goals are less than 95 when you check it fasting, and then you want it to be less than 120 after each meal. You will be given a glucose log or a diary, basically, that you use to write those numbers down. So it's most important that you bring that log to every single visit with your provider, because we need to review your blood sugars to know how well your diabetes is controlled.
I was reading that current research shows that women with gestational diabetes who are successfully treated have similar outcomes to women without gestational diabetes. Is that true?
That is absolutely true. The most important thing is that moms who are diagnosed with gestational diabetes understand that if they take care of themselves and follow the instructions of their provider, then they can deliver healthy babies.
Okay, I think I'm ready then. I'm excited to learn some more about specific gestational diabetes nutrition recommendations. Turning to you, nutritionist Ms. Robin Rockwell here, can you start by telling us a bit about how what we eat impacts our blood sugar?
Well, you've probably already heard of carbs or carbohydrates.
Sure.
Carbs are nutrients that we eat that turn into blood sugar.
Okay.
The main food groups that have carbs are grains, so think crackers, pasta, cereals, fruit, dairy, mainly milk and yogurt, and starchy vegetables, so potatoes, corn, and peas. Everyone's favorite vegetables, of course. So when we eat carbs, our blood sugar is going to go up proportional to how many carbs we eat. That just means that when we eat small amounts of carbs, our blood sugar goes up a little. When we eat large amounts of carbs, our blood sugar can spike up a lot. But we have to have a balance because carbohydrates are also our main source of energy for our body. So we want to have energy without our blood sugar going up too high.
I've also heard about good carbs and bad carbs. Can you tell me more about that? Who's a good carb? Who's a bad carb?
Some carbs are definitely better for us than others. So great carbs to eat are going to be whole grains, whole pieces of fruit. These have fiber. Fiber slows digestion, but in a good way. That just means when you eat your food, it's going to turn into blood sugar at a slower rate, and it won't go up as high. Another great carb source is milk, because it has calcium in it too, and protein. Carbs that aren't quite as good for us are ones that taste quite sweet. So think soda, juice, added sugars, honey, maple syrup. These are going to turn into sugar quite quickly. And of course, all sweets, even candy, even small amounts of candy, can make big impacts on blood sugar.
And I've always kind of heard that in gestational diabetes, the proteins and the fats are your friends. Why is that?
Well, everything we eat really comes down to carbs, protein, and fats. Now, protein and fats will not spike your blood sugar when you eat them, and they can actually help keep it a little lower. They can blunt how high it rises when you eat carbs. So the best thing you can do, don't eat your carbs alone. Match them up with a protein and a fat. I like to think of them as anchors. They can keep things more steady.
Whenever I think of a protein, I feel like I have to go throw a slab of meat on the grill. I'm sure there's more options than just meat, right?
Oh, sure. You don't have to always be eating red meat or pork. You can definitely do grilled chicken. Chicken's especially good when you don't have the skin on it, especially good for you. Fish is a good option. Beans or lentils. We even have some lentils right here. Eggs, another great option. Great options of fats are going to be avocados or nuts, and your best fats to cook with are olive oil and canola oil.
Olive oil and canola oil. Okay, I'm going to remember that. So I think we've really covered a lot in terms of thinking about the kinds of foods that you should be getting in your diet once you've been diagnosed with gestational diabetes. I'm a little more unsure about when people should be eating, how many meals a day, what kinds of snacks, things like that.
Oh yeah, let me walk you through a typical day. You may remember earlier I talked about how your blood sugar rises proportional to how many carbs you eat. So it's best to spread those carbs throughout the day. You want to do about 3 meals and maybe 2 to 3 snacks. That's going to give us smaller ripples in our blood sugar and not a big roller coaster spike and then a drop. So for example, you wake up in the morning, you definitely want to have breakfast. Now some women, their blood sugar is particularly sensitive in the morning, and fruit and milk can really cause it to spike. But you're always safe with having grains for breakfast. So a good breakfast could be scrambling some eggs with cheese, maybe your favorite vegetable in there, and 2 slices of whole grain toast with a little bit of butter. Then wait about 2 or 3 hours and have a mid-morning snack. A snack could be a low-sugar yogurt and some almonds. And then for lunch, maybe a grilled chicken sandwich on whole wheat bread or a whole wheat bun. You can have a small piece of fruit on the side, like an apple, and your favorite vegetable. And then an afternoon snack could be, some cheese and another small fruit, like an orange. And then for dinner, maybe a piece of fish, a side salad, 2/3 cup of rice. Brown rice is going to have more fiber, so your blood sugar won't go up as high with it. And then for dessert, you can have some berries. And then a snack before you go to bed could be a glass of milk, half an English muffin, and some peanut butter on it.
I love all these examples, and obviously there's a lot of space for people to get creative too. You don't have to eat the same thing every day.
No, definitely not. Other great snack examples could be a tortilla with some cheese, maybe cottage cheese and fruit. You can even go to restaurants and eat things like burgers, preferably on a whole wheat bun. Be careful at restaurants, especially about the sides that you get and the serving size of the food you eat.
Speaking of serving size, does size matter even if you're eating healthy foods?
It definitely does. Too many good carbs is still too many carbs at times. So make sure you're paying attention to portion sizes and especially to food labels. So your food labels are going to be on your packaged items, and they are often representing carbs for just one serving, not for everything in this box. So you have to be careful and always look, what is the serving size for the food you're eating?
That seems like good advice for all of us, whether or not we have gestational diabetes. Thank you so much for coming in and talking with us today, Ms. Rockwell, and for taking the time to kind of help us out and learning more about some important early diet changes that we can make when we get the diagnosis of gestational diabetes.
You're so welcome.
Dr. Jones, is there anything else that you recommend to your patients when they're newly diagnosed with gestational diabetes? What else can help?
Absolutely. Exercise. Exercise helps our body to better utilize insulin. So I recommend that all of my pregnant moms engage in some type of exercise. If you already had an exercise routine prior to pregnancy, it's perfectly fine for you to continue that. If you didn't, think about starting a new exercise routine, like some low-impact aerobics, like Zumba, maybe even riding a stationary bike or an elliptical machine, dancing, yoga, Pilates. All of those are great forms of exercise that you can do.
And Dr. Wirtz, if exercise wasn't a regular part of someone's life before they got pregnant, what could they consider doing once they became pregnant?
If you're brand new to exercise, the best entry-level thing to do is start walking. Walking is safe in almost every pregnancy. Women with gestational diabetes should walk for about 30 minutes a day. Research has shown that within 10 days of initiating an exercise program, up to 60% of women with gestational diabetes will have achieved normal blood sugars.
Excellent advice. Thank you guys so much for all of your expertise today. And thank you for tuning in. From all of us at Unity Healthcare, we want to wish you health and wellness during this pregnancy, and we look forward to seeing you in the office soon.